Thank you very much, Mr. Chair. Good morning, everyone, and thank you very much for giving me the opportunity to present about Gavi this morning. I'm Adrien de Chaisemartin. I'm the Director for Strategy, Performance and Risk at the Secretariat. So what I thought I would do today is just, and most of you probably know a little bit about Gavi at different levels, so I'm going to spend a bit of time just presenting the basic model of the partnership. And it's actually quite relevant also in terms of our time frame for looking back at how we have worked together with our partners, because we're shifting into a new strategy starting in 2015. We actually have a replenishment with our donors in January next year, and we're therefore really looking at the model, the shift in our objectives, etc. So, about Gavi, very briefly, as you all know, Gavi is about increasing access to immunization in poor countries. Obviously, this is to save children's lives but protect people's health. There has been an evolution in Gavi's life from a focus on a few specific children's vaccines to a much wider portfolio of vaccines that would actually improve health along the life course. There are actually four goals, that Gavi is trying to accomplish. The first one is about obviously introducing vaccines in the immunization schedule of developing countries, and that's the core of our funding, where the core of our funding is going to. The second one is about health systems. So we recognize that you can't just roll out a vaccine in a weak health system that's not able to deliver the vaccines to the children. The third one is about sustainability, so making sure that countries themselves pick up the cost of the vaccines in the long run. So we have a co-financing policy by which countries, depending on their GNI, pay part of the vaccines. And we have a graduation policy by which when countries go over a certain threshold of GNI, they actually bear the full cost and they graduate from Gavi support. And the last one, which really also is relating to the PPP model, is about market shaping. So with the goal to increase supply and availability of quality vaccines, but also decrease the cost to make it affordable for the countries. So the partnership model, Gavi was initially created as a partnership between the WHO, UNICEF, World Bank, and the Gates Foundation, and actually since the beginning have involved a number of stakeholders from obviously the four funding members, but also the government of developing countries that will receive Gavi support, the government of donor countries that are donors to Gavi, the vaccine industry, whether it's from the developing countries or industrialized countries, civil society organizations, and research and technical health institutes. So that's actually the picture of the Gavi board. And each of these constituencies actually contribute to Gavi's mission in a certain way, and I'm going to go through that. So very briefly, as I mentioned, this is the list of antigens that Gavi is supporting. When you look at, so Gavi was created around the years 2000. The initial vaccine that Gavi supported was the pentavalent one, which 5 vaccines in one, including hepatitis B and Hib vaccines, which was very much focused again on children's vaccine. There was a yellow fever vaccine that was added a bit later. That really grew along time with the development of new vaccines, and now is covering most of the antigens that countries the developing countries would provide. It only excludes actually 2 vaccines, which is the tetanus vaccine, the birth dose, as well as the BCG vaccines. But most of the vaccines that would be provided in developing countries are supported by Gavi. The way the support model works, so we have 73 eligible countries on the basis of GNI per capita. So all the countries that have GNI per capita below 1,500 are eligible to receive Gavi support. We provide 2 types of grants to countries. One is, and the majority of our grants is the vaccine support. So we actually pool the demand for certain vaccines, work with UNICEF to do the procurement of these vaccines, and then send the actual vaccines to the countries. That's the majority of our funds. And the second type of grants that we have for countries is the health system one, which is a financial support to countries to improve their health system with a focus on immunization outcome and building the system so that it can deliver vaccines. We have done in Gavi's existence 93 vaccine introductions, so there's not 93 vaccines, but 93 vaccines/countries. across 52 countries. So not all of our countries actually applied. And you can see that the majority of our countries are in the sub-Saharan Africa regions, the Asia region for smaller part, and then a few countries in Latin America and Eastern Europe. So very briefly, over the past 14 years, and we've vaccinated, not we have, countries have vaccinated with our support 440 million children, averting 6 million future deaths. And we've done more than 250 vaccine introduction and campaigns. So we've supported these in the Gavi countries. Now let's have a look at basically the lesson that we've learned from our partnership model so far. And there is actually quite an interesting contrast between the global level and the country level, and how we've been able to really leverage our partners in making a difference in country. So at the global level, the partnership model have really been impactful on two dimensions. First is on the resource mobilization with the IFIM vaccine bonds, and I'm going to go into a bit more details, which is a way to front load the donors' funding that are committed in the long run. Again, on resource mobilization, the matching fund, which is an incentive for contribution from the private sector. And on the market shaping side, basically with two things that we've been able to do as a partnership, which is mostly around the advanced market commitment, specifically for pneumococcal vaccines, and we are exploring doing a similar mechanism for the Ebola vaccine now, and the creation of a reliable market by pooling the demand from countries and doing central procurements to decrease prices and increase the availability of supply. So I'm going to very briefly go through these four elements. So on IFIM, one of the key success factors for Gavi was actually to be able to have very early on enough funds to be able to procure globally the vaccine at a reasonable price. The Gavi was also set up in a way that was supposed to accelerate the introduction of these vaccines. So it wasn't supposed to be a long-term organization that would stay for a number of years, but actually catalyze the introduction of these vaccines and then ensure sustainability. So what that required is having funds early enough in Gavi's lifetime, enough funds to start this whole process. And that's what IFIM allowed us to do. And the way it works is basically you have government donors or private sector donors who commit legally binding donations in the long term. And working with the World Bank, we raise bonds on the capital markets to actually access that funds earlier. And we've been able to raise $4.5 billion in between 2006 and 2013 of money that we will continue to receive over the next 20 years. So that was really rendered possible by the contribution from our donors, but then the contribution of the World Bank, who has been managing that process. And ultimately, that's been one of the big success of Gavi, is actually that led to an acceleration of the introduction of the vaccines in our countries. If not, we would have had to stagger the introduction in different countries, and we wouldn't have had the acceleration we have seen to date. The Gavi Matching Fund, another mechanism that's linked, that we've kicked off as part of our public-private partnership. It's a very simple mechanism to encourage, incentivize the private sector contribution. And here the idea behind it, and DFID and the Gates Foundation are the one behind that model, was to say that the contribution from private sector is more than just the flow of funds that they would provide to Gavi, but it's actually the contribution in delivering the immunization programs, in providing innovation in the field of immunization, etc., and bringing some capabilities that are required to deliver these programs. For example, logistics on the ground and on the cold chain aspects, etc. So the way it works is any private sector contribution, whether in financial resources or in knowledge and skills, etc., would be matched by DFID and the Gates Foundation. And so far, there's been 230 million raised in the year between 2011 and 2014. On the market shaping side, so the advanced market commitment, I understand you've discussed it a bit yesterday. So it's basically a mechanism by which we commit as the Gavi Alliance with our donors to fund a new vaccine that would respect a certain set of criteria. So we define a product profile, and then we commit to purchase the vaccine at a certain price, which provide then the incentive for manufacturers to develop the vaccines and they would legally commit to actually supply the vaccine at a certain price. And that's done in parallel with creating the demand from the developing countries to actually use the vaccines once it's available. So we've done that for the pneumococcal vaccine, which has been rolled out now to more than 38 countries so far. It has significantly increased the number of doses that were available for that vaccine for the Gavi countries. There has been debate around the price that was set up in advance, etc. And so, the success of that mechanism is definitely the growth, the increase in availability of supply, the number of vaccines that have introduced, number of countries that have introduced that vaccines, and then you can always there is then debate around the price and how that will evolve in the long run. Just one note: we are actually thinking and working with our donors to think about whether we could do that for the Ebola vaccines, which would be potentially available in 2015, and whether we could already set up a mechanism to actually fund the available doses and provide incentives for development. Lastly, just on market shaping, again, one of the success of the partnership was the ability to get prices down for most of the vaccines. So what you can see here is on most of the Gavi vaccine, the difference in price that as an alliance we're able to get by pooling procurements with the contributions from the pharmaceutical industry, who didn't, again, contribute financially, but contribute by actually decreasing their price, ramping up their production. So, for example, for the Penta vaccine on the left, we're getting it at $2 versus $36 in the US public market. Pneumococcal vaccine, $3.50 instead of $107, rotavirus, $2, etc., etc. Lastly, on the work with manufacturers, that process by which we can pool the demand, have a forecast of what countries will need in the very short term, was also an enabler for increasing the vaccine supply. And you can see the difference for, in terms of number of suppliers for the Penta vaccine from 2001 to 2013. So let me touch base briefly, and at this stage, it's going to be more questions than answers about our effectiveness as a public-private partnership at the country level. And that's probably where we have the most margin for improvement. So first of all, as much as the focus for Gavi has been in the past 14 years on vaccine introductions, making sure that we get the right vaccines on the immunization schedule of the developing countries, the next strategy period, 2015-2020, will be about increasing immunization coverage in our countries. We will still have some introductions, but the idea will now be to actually reach these unreached. When you look at the countries we support, there is still 21.8 million children that are under-immunized, so either partially immunized or not immunized at all. Most of them are in a few countries, so it's India, Nigeria, Pakistan, which are not, which have their own challenges, but it's actually then spread around a high number of countries. When you look at specific situation, that's just a picture of Madagascar. What you can see here is in green, the regions where the coverage is actually high, and obviously around the capital in the more urban areas, the coverage is acceptable. While in the periphery, in more rural, you have difficult to reach geographies, the coverage is much lower. So the challenges that we are going to face in the next period are really not only national, but sub-national level. And that's where, as a global partnership, we've been successful as fundraising and getting the vaccine in the schedule. The next set of challenges is much more local, and we'll need to leverage contribution from different partners in a very different scale. So the question that we are really grappling with now is then how do we better leverage the presence of our technical partners on the ground? So Gavi's model has been created as a very light touch. So we have a very small secretariat managing these programs, which we're focusing on the global fundraising, global mechanism for market shaping, fundraising, etc. Now we need to move with partners to actually working on the ground, so leveraging the presence of WHO, UNICEF, World Bank, the public sector also, the bilateral donors involved on the field on similar immunization or related fields. And one of the challenges here is that Gavi, having been a global funding facility, we have worked a lot with the global level of our global donors, but not as much did we involve the local presence of these partners. And lastly, and actually, the private sector also, how can we leverage some of the skills and capacities in countries to deliver some interventions from the private sector. And lastly, one that's not actually on the sub-bullet is the civil society, which will play a key role. And how do we actually work with them? We've been grappling with that too. Should we actually fund them? Should we catalyze their contributions? Should we set up the right platform so that they can engage? How do we do that? Then the question is, how do we coordinate that? Again, we are we are a small secretariat managing the global programs. What funding should we provide to our partners to make sure that happens on the ground, and what role for the secretariat? So very last slide, very early answers that we are working on. So one is what we call our business plan, which is basically the definition of roles and responsibilities of alliance partners in each of the 73 countries. And it sounds simple, but just with working with institutions like WHO, UNICEF, World Bank, which have very much decentralized organizations in which regions or countries are very much independent and working based on their own priorities, getting that alignment is quite an effort. Then we are trying to identify where there are gaps in the funding for that technical assistance to help countries, and what are the regional and local forums for coordination and partners. We are working on developing a private sector strategy to potentially engage the private sector on the delivery aspects in our countries. We are thinking of doing that through global level partnership that would then catalyze partnership at the local level. We don't want to be involved in every single country in 73 local partnerships with private sectors, and we're piloting in a few countries some specific projects. And lastly, one of the major questions, being very frank with you in this room, is what's the evolution of the secretariat? So in order to manage the issues on delivery in country, should we remain a small, lean secretariat and let the partners and trust that the partners on the ground will actually have the enough tools and mechanism to actually coordinate and provide that support? Or is there a role for the secretariat to be involved in that coordination process, which would then mean probably having a bigger secretariat, but which defeats the purpose of the initial idea of that partnership, which is leveraging the existing capabilities from the partners. So I'll stop there. That's probably quite a set of open question at this stage, but welcome questions and thoughts.
Well,